This is the non-surgical arena. I like to think of aesthetic medicine as three categories: surgical category, filler and Botox, and then the last category being energy devices.
At Solomon Facial Plastic, we have a lot of lasers, probably more than the average surgeon.
Some of the terms you'll hear are CO₂, that's a common one, carbon dioxide laser. You'll hear erbium laser, you'll hear YAG laser, you'll hear Pico laser. So those are all different types of lasers. The more aggressive lasers usually we're doing in patients either with acne scars or patients who are having significant anti-aging therapies in combination with often facelifts. She had a dramatic result in terms of the amount of freckles that are removed. And that's off one treatment. So it's a very powerful device. It can have dramatic enhancement of skin quality. Hey everyone, it's Dr. Solomon, and I want to welcome you back to another episode of Unfiltered. Today we're going to be talking to you about a big topic. We're going to try to dissect it and condense it to make it usable information. It is a huge part of the industry, and it's known as energy devices. And this is the non-surgical arena. I like to think of aesthetic medicine as three categories: the surgical category, and then within the non-surgical category, divided up into filler and Botox, and then the last category being energy devices. This topic is big and can be very confusing. It's a huge industry. A lot of marketing goes into this industry. We want to discuss it briefly, but to give you an idea of our perspective on what works, what doesn't work, and what may be useful for you to consider using in your anti-aging paradigm.
So, hi everybody. At Solomon Facial Plastic, we have a lot of lasers, probably more than the average surgeon. Dr. Solomon likes to be able to cover all different issues and concerns. He likes to have the newest, and he likes to have the best. So we do have a lot. We are also going to talk about lasers or treatment options that we don't have, but just fall under this umbrella. So let's start off by talking about the least invasive with the least downtime. And I know it can be broken into a few different categories. That's why this topic is a little bit confusing. So what is the least invasive laser?
Okay, so to simplify it, I just want to divide up energy devices into different categories. Lasers are just one of them. So there's light, which often is known as IPL. There's microneedling with radio waves, which is called radio frequency microneedling. There's radio waves or ultrasound waves on their own, which are just bulk heating type of techniques, which there's many different devices. One common device is known as thermage. And then there's Althera, which is an ultrasound device. And those have been around a long time, and they're useful for sort of anti-aging and bulk heating and presumably some tightening. And then you get into the laser energy devices, which have different mediums of delivery devices, depending on the actual laser being used. Some of the terms you'll hear are CO₂, that's a common one, carbon dioxide laser. You'll hear erbium laser. You'll hear YAG laser. You'll hear Pico laser. So those are all different types of lasers. So in terms of what the least invasive is, I would say the least invasive likely would be a light type of device, which is not a laser. IPL, and that's a common thing done in medi-spas as well as aesthetic surgery clinics. It's been one of the hallmark treatments for anti-aging. And what does it do? Well, it has filters, and it can treat some discoloration of the skin, either browns or reds, and it can have some photorejuvenation effects as well. There's been some scientific studies that have come out showing patients who get regular use of intense pulse light have significant enhancement of their skin quality, clearance of discoloration, and improvement of vascularity, which all come with age.
Okay. Does it address fine lines? Does it address wrinkles? Very
minimally. I think of them primarily as maintenance and rejuvenation of color.
And how many treatments do you need, and how much downtime is there?
There's almost no downtime. You may notice a little bit of darkening around the area that's treated. There's limited to no downtime. You can go on with most activities. It's something that needs to be maintained and repeated frequently, depending on your skin quality and skin type.
Okay, so that's a good entry point, depending on what your concerns are.
Correct.
Okay, so the next least invasive laser that can do a little bit more than the IPL, what would that be?
In our clinic, I would say that the next level up would be Pico. And Pico is a laser, but it's going to be aimed to enhance skin discoloration and early signs of aging. Pico is shattering some of the pigment. It's used primarily and initially for tattoo removal, But then it was identified that the mechanism of removing the tattoo and the pigment to clearance could be used as an anti-aging tool to get rid of some of the freckles that people got by physically shattering them with these tiny laser beams called Pico waves. So I would say that would be the next. You're red for about a few hours, like salmon red, and then it resolves. That's something you can do frequently, depending on, again, your needs and your skin type.
Okay, so let's just say how many treatments would the average person need? 3, 5?
It depends if it's for tattoo or for photo rejuvenation.
Let's say
I'd say we usually do minimum of 3 up to about 6. And then some people get on a maintenance package. It is also very popular in Asian skin tones because it's relatively safe on darker skins, whereas IPL starts running into limitations and troubles on what's called Fitzpatrick 4s and up, which is sort of tanned people, a little bit darker, East Indian, whereas an Asian skin and Middle Eastern skin, a lot of the skin types we see in Toronto. So Pico, we added to our clinic because we felt that IPL was actually not a good device for some of the darker skin patients. So we would steer them in towards the Pico category for maintaining their skin. And it can also be combined with microneedling radiofrequency, which is going to be doing something different, working more on sort of a little bit of texture, tone, and a slight tightening of the skin envelope. So we would do Pico combined with, say, Morpheus, for instance, or that's another trade name of a microneedling radio frequency. So you're kind of doing 2 devices in combination to improve your skin quality. And again, that would be limited downtime, red for a day or so, and something you can do multiple treatments and relatively safe.
Okay, next level up. Somebody wants something a little bit more aggressive. Would that be the micro laser peel, the NanoPeel category?
Yeah, so then we get into resurfacing devices.
Okay.
And this is where it gets very complicated because you have lots of different devices touting to do different things depending on the different wavelengths.
This is the confusing part.
Yeah, so then it's broken, to simplify, it's broken into 2 categories, non-ablative and ablative. Non-ablative technology means you're using laser beam energy to heat the skin but not burn away any skin.
I use my fingers when I'm showing patients, so it goes in this way. Is that right?
They're delivering sort of energy and heat into the tissues, but they're not reaching an area of basically damaging the tissue itself. You're not getting an actual evaporation effect of the skin, whereas laser beams actually burning away, you get some evaporation of the skin. So you're blasting a physical property of skin and turning it into smoke. That's ablative. Non-ablative means you're putting in the energy to a slightly lower temperature and a lower energy setting, and the tissue's absorbing some of those energies and heat, but they're not actually taking away any of the skin, but it's heating it or cooking it.
Is it a burn? Is this like a controlled burn?
They're both controlled burns, but one's reaching a temperature that's ablative. So if you look under a microscope at a non-ablative laser, you'll see these cores of tissue that are being cooked, but they're still there. Nothing's gone. If you look at an ablative laser, say a CO₂, you'll see cores of laser energy's gone in, and basically little pockets of skin have actually been evaporated, and little holes are actually present. So that's the difference. And you may say, well, what's the difference? The difference is controversial. Different doctors will tout different things, but in general terms, non-ablative technology is more limited, has less downtime, and has more limited rejuvenation, whereas fully ablative have more downtime, but more new skin's going to be forming.
Okay, so let's go back where we started. Micro laser peel, NanoPeel. That would be somebody who wants something to help refresh the skin, tighten some fine lines.
Yeah, so you get into different devices depending on which clinic you go to. So you could potentially get a bit of overlap here. You're getting sort of entry-level energy device lasers. We're now in the laser category, and you could have non-ablative or you can have ablative, but you could have ablative done on very light settings. So we have something called a micro laser peel. It's ablative. It's actually burning away a layer of your skin, but it's fully ablative, but it's very light. So meaning how deep does it go? Now we're going into the depth of the skin. Whereas you could have a non-ablative technology. We have some devices that do both. ProFractional would be a non-ablative one, which is going to be heating up the cores of tissue from the laser energy devices, delivered in what's called a fractional manner, meaning like little pixels coming into the skin, but they're not going to actually be evaporating any of the skin. So you're going to have, those are both sort of entry-level treatments. Some people can combine them. They can do a bit of ProFractional or a energy device that's non-ablative, like Fraxel. There's a bunch of them. And then on top of it or in tandem with it, you could do a little bit of a very light peel with a laser beam. So again, depending on what
Sounds
you're
very
looking to do.
customized. So you need somebody who really knows their lasers.
You need to know the skin type. You need to know
Yeah.
the lasers. You need to know how much downtime the patient's willing to accept. With lasers, it's really about what are you trying to achieve? How much
Right.
rejuvenation do you want to obtain, and what is the downtime that you're willing to accept? And then the skin type. So you're looking at one person's skin type, and there's a whole categorization of skin type. You're looking at basically the level of sun damage and photodynamic damage that's occurred in their skin. And you're looking at how much of that you want to reverse, how many treatments you want to put into it to reverse it, and how much downtime the patient's willing to accept.
So for a micro laser peel, which would be the entry-level laser category, that's about a 3-day downtime. What can you accomplish? Is it worth it? Is it worth the 3 days?
I think it's a very good device to consider adding, especially if you're entry level and you want to see what type of outcome you can get. I think for darker skin patients, it's safer than going into a fully ablative aggressive laser where you could potentially cause some pigment changes and create some theoretical changes to your skin that you're not comfortable with. So we often I tell patients, think of it as a pyramid. Now, depending on what your age and where your skin's at, when you're entering the pyramid, how high up on the pyramid you want to go. So at the top of the pyramid would be fully ablative lasers such as CO₂ or fully ablative aggressive erbium resurfacing. And at the bottom, we talked about it, you're going to have things like IPL and Pico. And you don't have to pick one or the other. You may play around with different devices to see how your skin responds. And so really you need to assess the patient, figure out what their objectives are, and see what they're willing to accept in terms of downtime and what's the safest device for their skin type. So it's really not like you just come in and buy whatever. We want to assess you and see what we think and make recommendations. But, there's patients that have tried everything. The common example of that would be patients with acne scar. There's not one device that fixes everything. So we'll see patients here because we've been treating acne scars and because we have so many different devices that they've had multiple devices throughout the city, spent tens of thousands of dollars and find they have limited upside with acne scars because they can be very frustrating to treat. Those patients may come in and only want the CO₂ because they've tried everything else. And if they have the right skin type and they've done okay and had no adverse outcome from the previous treatments, we may jump right to that. Whereas another patient may come in a younger age group and we may say, don't jump to a CO₂, you're young. We want to see how your skin responds. We want to start with more conservative treatments first.
I was going to ask you that question, actually. What's the appropriate laser for each decade? Or once again, I know a lot of it has to do with the anatomy and what the concerns are, but generally speaking.
I'm generalizing, but I would say the more aggressive lasers usually we're doing in patients either with acne scars or patients who are having significant anti-aging therapies in combination with often facelifts. Where they've developed significant smoker's lines, lots of brown marks on their skin, lots of fine lines around their eyes. We're using CO₂ or a combination CO₂ and an erbium resurfacing device. In younger patients in their 30s, coming in with some early signs of skin changes, maybe some pigment that's formed. Then we're doing Pico and some light laser peels.
So CO₂, the average downtime is about 7-8 days, 7 to 10 days.
Yeah, roughly that, but it really depends also on the energy setting. So each device will have its own sort of menu on it of how aggressive you want to deliver the energy device. So you may have a CO₂ at one setting and someone else may have a CO₂ at a totally different setting. So patients think they're all getting the exact same treatment, but really they're not. It's customizable as well.
Let's take a look at these two patients. This first patient was also a facelift patient, and she had CO₂. Did she have erbium as well or just CO₂?
I believe she had CO₂ active resurfacing, which is one of our commonest devices. This technique, this device in particular is really good for lifting pigment off the surface. So it's burning off layers in a fractionated, safe way off your skin. She had a dramatic result in terms of the amount of freckles that it removed. And that's off one treatment. So it's a very powerful device. It can have dramatic enhancement of skin quality. Here you're seeing the freckles are clear, but also the skin quality, texture, tone, pore size. Often on the nose we do it, and it can improve the texture of the skin on the nose. We have patients coming in who've had rhinoplasty who just want to do this to enhance the skin of their nose. So CO₂ device would be what was recommended, and you can see a typical example of outcome after one treatment.
I've got this patient now. So she had more advanced wrinkles and skin concerns, and I believe you did a combination of CO₂ and erbium.
Right. So this is a patient who's of more advanced age. She's got severe changes to her skin envelope. She's got sort of leathery type skin, and she's got significant fine lines or smoker lines around her mouth and textural changes on her chin and her entire face. So we did a combination of CO₂ combined with Erbium resurfacing device. Why would we combine the two? And again, this just is my opinion. Different doctors have different approaches to this. If you only have one device, you may, rely on that device. Because we have multiple devices, I play around with the different devices. I personally still feel that the Erbium laser resurface is the most superior device for resurfacing around the mouth. So someone like her, it was ideal. That device is very powerful and aggressive. Even though it's titled Erbium, it can be set on settings that are more aggressive than some of the CO₂ settings. But what differentiates it is that it's fully ablative, not fractionated, meaning that it's taking an entire layer of the skin and you're able to remove layer by layer. So you can actually see the depth of layers that you're going from 100 microns, which is like the amount of depth, physical depth of the skin that you're penetrating. You can either coagulate it or ablate it, means completely evaporate it or char it a little bit. So there's different properties. And in around the mouth area, it's a terrific device. I still feel like it's our best device for improving around the mouth. The CO₂, I find ideal for eyelid rejuvenation around the lower eyelids, tightening and improving.
It does a great job of tightening under the eyes.
Tightening under the eyes, it can be amazing. Again, we have the odd person.
It's like a non-surgical blepharoplasty, so to speak.
Yeah, no, for sure. And we use it all the time. We use it in combination. Our blepharoplasty is almost like universally, as long as the patients have the right skin type. And it's a terrific device. And in something like that, last patient we demonstrated, combining the two, I feel like it's gives us the best use of each device that we have at our facility. So we do a lot of combination treatments.
We missed one laser, the halo laser.
So halo laser is actually type of Erbium device. It's sort of a trade name for one of the settings, and that's taking the energy device that we use on that aggressive, fully ablative, fully resurfacing Erbium device and splitting the laser beam into almost little fractionated bits. So
And
it's a nice treatment, and it's sort of a quicker downtime. You still need to do
5 days.
5 days, but you need to do multiple to achieve a result. But it may be best suited for certain skin types, like slightly darker skin types that we may be wary about doing a CO₂ or an aggressive Erbium on. We may advise a patient, look, halo may be an in-between type of laser, which may be ideal for you to start with.
And it'll address fine lines.
Yeah, it's for
Wrinkles,
full texture tone, fine lines.
Okay. Are you ready to do a laser yet yourself?
I want to do a laser, but I need to find the downtime. I haven't done any resurfacing.
Downtime's the tricky part. That is the tricky part.
For me, the tricky part is that I often go south during the winter for either vacation or conferences. And so I need that little bit of downtime, and would rather do it after I'm not going to be, like after I've been away, so I have time to recover and not be going right back into a sunny environment.
This is the conversation we have with patients on a regular basis. And I bring this up because right now it's the optimal time. We're taping in October. So a lot of people are coming to us looking to do lasers because the winter months are the best months. People can find the time to hide out, work from home. But then there are the people that like to go south and travel. So it's about carving out that window of time where you can do a laser, have some downtime. And then let's talk about after the laser, really important. How long do people have to stay out of the direct sun for? Because people want to travel again. They want to go out and enjoy life. What's the risks?
Risks of a premature exposure to the sun after a laser is you may be sensitive to the sun. You could burn easier. I mean, it's also not going to be good for the outcome of your laser resurfacing. You're sort of going to be damaging the skin. You're sort of in a war with the sun your whole life. So the laser is part of your armamentarium to reverse the sun damage. So as you go back in the sun, you're going to be, again, taking away and prematurely aging the skin. So patients say, well, can I go in the sun and walk around and do stuff like that? I'd say, yes, absolutely. There's patients that live in Australia, South Florida, sunny environments that do laser resurfacing all the time. And they don't get the typical cloud cover we see in Toronto over the winter. So we have a bit of a different advantage in a way in that we have significant downtime typically in Toronto to like laser season. But if you're living in the hot climates, they're going to be doing laser. Just be cautious. Wear a big brim hat and
lots of sunscreen.
Yeah.
There you go.
Yeah. Okay. I hope that was helpful. I think we covered a big territory. I mean, there's people write textbooks on this topic, but if it brought some clarity to you and made it a little bit more understandable, then it was worth listening into our podcast today. Thanks once again for tuning in to Unfiltered, and we will hopefully see you back soon.